Hi, my name is Randy and I'm a student at Maryville University. Today I'm going to be performing a head-to-toe assessment on my patient Kurt. Prior to entering the examination room, I requested that Kurt empty his bladder and change into comfortable clothing or a gown. I then watched him ambulate into the room and determined that his gait was steady, there was no ataxia, he was well developed, well nourished, and well muscled. We then conducted a conversation and I determined that he was alert and oriented ×3. Following that, the measurements were taken, such as vital signs, including height and weight. His distance vision was checked using the Snellen chart. His near vision was checked using the Rosenbaum chart. I'm now going to assess his head. I note that his head is normal cephalic, it is symmetrical, it is upright and still, it is negative for any tics. His external characteristics such as his eyes and his ears are symmetrical. I'm now going to touch your scalp, Kurt. It is negative for any depressions. There's no masses, no deformities noted. His scalp is movable. Is there any tenderness?
No.
There's no tenderness noted. It has no scaling. There is no tics noted. All right. His hair is unsymmetrically distributed on the top and the sides of his head and the posterior aspect of his head with areas of alopecia. However, it is brown and throughout and his follicles are smooth. Right now, at this time, I'm going to touch your facial bones. I'm going to palpate around your face. Is there any pain or tenderness?
No.
Your sinuses area, your facial sinuses, maxillary bone, and your temporomandibular joint. Can you open and close your mouth? Good. Is negative for any popping, any clicking. Is there any pain?
No.
Okay. Is there any tenderness?
No.
Good. I'm now going to further assess Kurt's cranial nerves and check that his cranial nerve 7 is intact. Kurt, can you wrinkle your forehead? Good. You squint your eyes and close them tightly. Good. I'm going to have you smile. Good. Puff out your cheeks. Clench your teeth. Good. I'm going to have you purse your lips and blow out. Good. Maybe stick out your tongue. Move it up and down and side to side. Good. His sensory nerves can then further be checked if wishing so to do. Checking the sweet and salty taste. His cranial nerve 9 can be checked with the bitter and sour taste. I'm then going to take a soft area. I'm going to touch his forehead. Can you feel that okay? On his cheeks and on his chin. Does that feel okay? Good. I'm then going to assess his eyes. And his eyes appear to be symmetrical on his face. His orbital and his periorbital, there's no redness, no swelling noted. I'm going to have you close your eyelids. His eyelids close completely. There's no scaling, there's no redness, there's no swelling. I'm going to palpate around your eyes. Is there any pain or tenderness?
No.
Good. You can open your eyes. His eyelashes are symmetrical. They're evenly distributed. They curve out away from his orbitals. His eyelashes are symmetrically distributed out past his outer canthus. His sclera is nice and white. I'm going to pull down your eyelids. His conjunctiva is nice and pink. His irises are brown. His pupils are equal and rounded bilaterally. We're now going to check his peripheral vision using the confrontation test. First, I'm going to have you cover your right eye, and I'll cover my right eye. Tell me when you see my hand.
No. No.
Okay. Good. Opposite.
No.
Good.
No.
Good. I'm now going to have you look past my shoulder and look at my finger. Accommodation is noted in bilateral both of his eyes. I'm then going to have you follow my finger. There's no extra movement noted, and his eyes move symmetrically and evenly throughout. I'm then going to have you cover and uncover your eye. Now uncover your other eye. Uncover that eye. And there's no strabismus noted in either of his eyes at this time. I'm now going to use a bright light in your eyes and checking for direct and consensual pupillary constriction. You look at me. I'm going to shine a bright light in your eyes. Direct and consensual in both of his eyes. And same in that eye is direct and consensual in both of his eyes. I'm now using my ophthalmoscope. I'm going to check his red reflex. Using my right eye, his right eye, and I'm going to start at 0 on my ophthalmoscope and going in. Good. And the other side. The red reflex is noted in both of his eyes at this time. I'm now going to inspect his ears. His auricles are lined up bilaterally, and then they are both symmetrical, and they line up with his outer canthus. There is no exudate. There is no lesions noted. They're nice and pink, and with the rest of his face, I'm going to palpate your ears, Kurt. Is there any tenderness?
No.
There's no tenderness noted. There's no nodules noted at this time. They're both firm. They're both movable as well. I'm now going to inspect his inner aspect of his ears using my otoscope, checking the his inner canal, ear canal, and checking for any redness, checking his tympanic membrane for no perforations, no redness. This tympanic membrane is nice and pearly gray. There's no perforations, and I can see the landmarks bilaterally. This ear, I can see all the landmarks. There's no redness. There's no perforations noted as nice and pearly gray. Same with this side. There's no redness. There's no exudate. There's no perforations. This tympanic membrane was nice and pearly gray. And that side as well. I'm then going to check using the whisper test. I'm going to have you cover your right ear. Close your eyes. I'm going to whisper a word to you, Kurt. You tell me what it is.
Hello.
Good. And the other side. Whisper a word. About 1 to 2 feet away is where I need to be, as I am.
Hello.
Good. We're now going to perform the Weber test. The Weber test, I'm going to take my tuning fork and I'm going to put it on top of his head. Kurt, can you tell me if you can hear this in both ears, please?
Yes.
Good. Now I'm going to check the rhyme test for auditory function as well, just as I checked the last 3. Checking for the air conduction is greater than bone conduction. Tell me when you can't hear it anymore.
No.
Good. And with this side, tell me when you can't hear it anymore.
No.
Perfect. I'm now going to inspect his nose, and noting that his nose is symmetrical, it's normal in color. I see no lesion noted. I'm going to palpate your nose. Is there any pain or tenderness?
No.
Good. I'm now going to inspect his nostrils. You can lift up your head for me. His nostrils are oval. They're symmetrical. There's no flaring noted bilaterally. Using my otoscope, I'm then going to check up his nostrils, checking his turbinates, his septum, and his mucosa. Noting his mucosa, ensuring that it is nice and pink. His turbinates are nice and pink. There is no swelling in his septum. There are no perforations, and there is no redness. Good. Thank you. His cranial nerve 1 can then further be tested using smells such as peppermint or orange. I can have him smell that at this time. We are not going to do so, however. I'm then going to check your nasal. I'm going to have you cover your right nostril. Can you breathe okay? Good. And the other nostril. Good. There is no flaring noted bilaterally at all with that as well. I'm then going to check his mouth, noting that his lips are nice and pink and smooth. There is no scaling. There's no crusting. There's no lesions. I'm then have you open your mouth, Kurt, noting that he has 28 teeth present. There's slight wear noted on them. Throughout, his gums are intact. His buccal mucosa is nice and pink. There is no lesions. There is no redness. There's no swelling. His tongue is nice and pink and rough. On top, it is red. It is pink. It is midline. It is symmetrical. There is no tremors. On his bottom of his tongue, there is no redness. It's nice and pink. His frenulum is present. On his, lift up your head for me. I'm going to check his hard palate. His hard palate is intact. His soft palate is also intact and continuous into his hard palate. His tonsils are not present. This time he had a tonsillectomy. So I'm just going to check to make sure his uvula is midline, and his midline, his pillars in the back are also pink and intact, and his posterior pharynx is also pink and intact, and there's no swelling, no redness. And then going to inspect, and his there was no odor also coming from his mouth at that time. Inspect his neck, noting that it is his trachea is midline, it has well musculature, there's no lesions, there's no jugular venous distension, there's no goiter, there's no carotid pulsations noted. At this time, I'm then going to inspect his carotid arteries, checking one each bilaterally. The rate is regular and pulse is strong. Rate is regular and his pulse is strong. His trachea is midline. Check his thyroid. You take a swallow for me. It is not enlarged, it is smooth. I'm then going to check his lymph nodes. Will you please let me know if there's any pain or tenderness when I palpate all around you? His occipital, his postauricular, his preauricular, his tonsillar, his submandibular, and then his submental, and his superficial anterior cervical chain, his posterior cervical chain, his supraclavicular, infraclavicular. Let me raise your arms, check his axillary lymph nodes. Good. And then I'm going to have to check your deep cervical chain. Maybe tilt your head this way. I'm going to palpate deep into the clavicle. No tenderness. The other way. There's no nodules, no tenderness noted throughout all of his lymph nodes. At this time, I'm then going to have you tilt your chin to your chest. Good. Head back up. Turn to the right and to the left. Good. I'm going to have you tilt your head back. Good. I'm going to have you push against my hand. Good. And against this hand. Perfect. I'm going to have you shrug your shoulders. Good. And now I'm going to listen to his carotid arteries. I'm going to have him take a deep breath in and hold it so I can listen for any bruits at this time using the bell of my stethoscope. Okay, you can breathe. And the other side. And there are no bruits noted. And then I'm also going to listen to his thyroid. You can breathe. Make sure there's no bruits noted on bilateral lobes of his thyroid. Good. This time I'm then going to inspect his shoulders, his arms, and his hand. Note that they are normal in musculature. In length, his nail beds, they are firm and strong. And the capillary refill is less than 3 seconds. His hair is evenly distributed throughout his arms. There's no change in temperature throughout. There's no, on his nail beds, there is no clubbing noted. I'm going to check his brachial pulses. They're equal and regular bilaterally. And they're equal and strong and regular bilaterally in his radial pulses as well. And at this time, I'm going to have you turn around. I'm going to check the posterior part in your back. His posterior back. Note that his skin is clean, clear, and intact. There is no heaving. There is respirations. There's symmetrical rise and fall of his back. His respiratory rate is not unlabored. It is within normal limits. And his rate is regular. I'm going to palpate along your back, Kurt. Is there any pain or tenderness noted?
No.
Okay. I'm going to check his costovertebral angle. Is there any pain here?
No.
Right here?
No.
Good. Now I'm going to feel for symmetrical rise and fall of his chest. Good. I'm going to have you check tactile fermentus this time. Can you say 99 for me?
99.
Again?
99. 99.
Perfect. And now I'm going to check for his diaphragmatic excursion. When he takes a deep breath in, there should be about 3 to 5 centimeters between his lungs when he exhales and inhales. I'm going to have you inhale first for me, and I'm going to palpate, percuss from resonance to tympani, resonance to dolus. Okay? And now I'm going to have you do this exhale, breathe, and then exhale as much air as you can for me. It's about 5 centimeters, and I'm going to do that on the other side as well. It's about 5. Okay, now I'm going to have you exhale. It's about 5 centimeters as well. At this time, I'm also going to note that his lateral aspect, his AP diameter is greater than his lateral aspect. I'm going to check his lateral sides bilaterally. I note that his skin is clean, clear, and intact. I'm going to palpate along his lateral sides. Is there any pain or tenderness there? There's no pain and tenderness on both sides. No deformities, no nodules, mass is noted. I'm then going to listen to his lungs, his posterior, and his lateral chest. And through that time, I was listening for any crackles, any rails, any wheezing, and I noted that all of his lung sounds were noted to be clear, which is a good thing. Kurt, I'm going to have you turn around for me. I'm going to check the front of your chest, the anterior part. I'm going to note that there is even rise and fall of his chest. The rate is normal. His respirations are unlabored. There is no pulsations noted. His skin is clear and intact. There are no lesions noted at this time. I'm going to palpate along your chest. Tell me if there's any pain or tenderness. Okay. I'm going to check and see rise and fall of your chest is equal and symmetrical. Read for me. Good. I'm going to have you check your tactile photosis. Say 99 for me.
99.
And again.
99.
And again.
99.
Perfect. At this time, I'm then going to listen to his anterior lung sounds and his heart sounds as well. Prior to that, however, I'm going to check, make sure there's no heaves or thrills. His apical pulse, and it's good. I'll listen to you. Then I'm going to listen to his heart sounds, his aortic, his pulmonic, his Erb's point, his tricuspid, and his mitral. Kurt, now I'm going to have you lay back. I'm going to inspect your abdomen at this time. Using my light, I'm going to note the contour of his abdomen. It is symmetrical. There is no bulging. There's no pulsations noted. His skin is clean and clear and intact. His umbilicus is midline. It is inverted. There's no pulsations. It's symmetrical. His abdomen is symmetrical throughout. I'm then going to listen to all 4 quadrants of his abdomen. Listening to peristalsis, listening for peristalsis. And then I'm going to listen to his aortic, his renal arteries, his iliac artery, and his femoral artery. Okay. I'm now going to touch your abdomen again, Kurt. I'm going to percuss, check for dullness and tympany. Dullness to be noted over his spleen on the left side and liver on the right, which it is. And that's good. I'm then going to check the size of his liver, going down and going down. It should be 6 to 12 centimeters and about 10, so that's good. I'm now going to palpate lightly. Please tell me if there's any tenderness or pain. Okay. And a deep palpation. Is there any pain or tenderness? I'm also looking for masses at this time. No pain?
No.
Okay. I'm going to palpate up along this liver. When he breathes out, I should be able to feel it. And I can feel it right in there. And No feeling on his spleen on this side, which is a good thing because whenever his spleen is enlarged, which is not good, is the only time you can feel it. I'm also going to feel for his aortic pulsations and his left kidney and his right kidney. Thank you. At this time, I'm then going to inspect his lower legs, lower extremities. Note that his muscle mass is even and his legs are symmetrical in length and they're both symmetrical. His hair is evenly distributed. It is similar in color and temperature throughout. His toenails his capillary refill is less than 3 seconds. There is no clubbing noted. His toenails are firm. There is firm at the nail beds. They are round. They are hard and smooth throughout. I'm going to check your popliteal pulse. His posterior tibial and his dorsalis pedis. I am then going to check his reflexes at this time. Maybe lift up your arm, Kurt, and your arm slightly. Check his bicep. Okay. His brachioradial, and then his triceps. Good. His popliteal and his Achilles tendon. And I complete that on both sides. Kurt, I'm not going to have you stand up for me. I'm going to have you bend over. I'm going to check his thoracic, his lumbar spine, and make sure everything is symmetrical. And then he has full range of motion. You can stand back up. I'm going to have you turn. I'm going to have you squat down now and check he's got full range of motion. You can stand back up now. At this time, all of his cranial nerves have been checked. And this concludes this examination. Thank you very much, Kurt.